Awareness on breast cancer, a dark fantasy. Lead and robotic surgeon of breast oncology at Apollo Cancer Center, Dr. Jayanti Thumsi, addressed an exclusive media gathering at Chancery Hotel on Lavelle Road in Bangalore this morning. It was also an occasion to promote Check Olate, dark chocolate, that could be a lifesaver among women wobble under breast cancer. Dr. Jayanti claimed that in India, breast cancer has spread at an alarming rate as a disease, particularly among the younger women, which is rampant. Kannada Cine star Pooja Gandhi was the chief guest at the event besides other hosts. Pooja Gandhi expressed her willingness to work for the just cause to save lives as she prioritized her schedule for a noble cause to create awareness on breast cancer soon after lighting up of the ceremonial lamp in the presence of several dignitaries. During the event, oncologists stated that breast cancer does not have any hereditary factor, as it can be related to lifestyle disease. Early detection could prevent nearly 90% of the patients by preventing them from acute health trauma that could be fatal. Dr. Jayanti presented a sweet reminder to check by way of consuming a small tartlet of dark chocolate termed as Choclate that has proven remedy to prevent breast cancer, and clarified that they are not promoting any brand but speaking with authority as per the studies conducted by oncologists world over. Before formal media address, there was an animated video presented to the media on proper understanding of the ailment that presented self-care over breasts, cleavage and nipples that can check over the lumps, swelling in certain cases that could cause cancer in breasts. Dr. Jayanti further stated that the advancement in treatment is no longer dependent only on chemotherapy or immunotherapy, but offers several better options at corporate hospitals treating under same roof, with encouraging results to counter cancer causing cells in breasts.
Modern medicine in cancer therapy has evolved over the past 40 odd years. So prior to 40 years, we didn't have any treatment, and the chemotherapy were the first drugs to kind of transform a lot of cancer treatments that we were giving. But over the past 2 decades, I think a lot of newer treatments have come along, and immunotherapy is one of those treatments. In particularly with regards to breast cancer, it is transforming how we treat triple negative breast cancer, which is one of the most aggressive forms of breast cancer. But immunotherapy is not a replacement for chemotherapy, and I think this is one thing I want to get across, that immunotherapy is generally used in conjunction with chemotherapy in breast cancer. So you have to use both, and chemotherapy is still the mainstay of treatment. Chemotherapy itself has come a long way. The toxicities are much milder now. We are better equipped to deal with the side effects of the chemotherapy. We have better, more advanced protocols to ensure that a lot of the side effects can be prevented before they actually happen. Apart from immunotherapy, we have other drugs, a new group of drugs called antibody drug conjugates that are coming on, where chemotherapies are tagged to targeted therapies with significantly reduced side effects, and this has come on in the past 5-7 years. So I think as with passing time, more and more research happens, newer drugs keep coming into the system, thereby changing our patients' lives. So what has now happened is breast cancer to a significant extent has become curable. But even if we are diagnosed with stage 4 cancer, we are looking at breast cancer becoming a chronic disease rather than a life-limiting disease. And that is thanks to all of these newer medicines such as antibody drug conjugates, immunotherapy and chemotherapy.
Thank you, doctor. Thank you.
Just to add the second part of it, how to make it more accessible. Anything can be only made accessible in the country if the focus is to make sure everything is looked inward and you have a program either make or made in India, because that's the only way you're going to reduce the cost. Otherwise, every time you import equipment, whether it's for diagnostic or therapy or a drug, the cost of that, including the import duty, gets passed on to the consumer. One of the things we have been urging the government is to see how could we be very self-reliant to make sure most of it has happened here, so you don't have to have the cost of acquiring a technology passed on to the consumer. A long way to go, but we are making steady progress. There is multiple of these diagnostic technologies and therapeutic techs which are today available in India, made in India.
Regular self-examination is the key to early detection and helps reduce the risk of death from breast cancer by 90%. The path to fight breast cancer is in your hands. Be your own breast examiner. Step 1. Stand in front of a mirror with your shoulders straight and your arms on your hips, and look at your breasts. Observe for any difference from their usual shape, size, color and contour. Observe that they are without visible dysfunction or swelling. Observe for any dimpling, puckering or bulging of the skin that wasn't there before. Observe if the nipples have changed position or inverted, pushed inward instead of sticking out. Observe for redness, soreness and rash. Observe for fluid coming out of the nipples. Could be a watery, milky or yellow fluid or blood. Step 2. Raise your arms above your head and look again at your breasts and carefully repeat all the things to check for in step 1. Step 3. Next, feel your breasts while you're standing or sitting. Use your right hand to feel your left breast and then use your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping the fingers flat and together. Be sure to feel all the tissue from the front to the back of your breasts. For the skin and tissue just in the middle of your back. Feel for lumps, swelling or thickening of tissue or enlarged lymph nodes. Cover from top to bottom. Start at your collarbone and slowly move down to the top of your abdomen. After the right breast, repeat from side to side. Start from your armpit and move to your cleavage. After the right breast, repeat the same for your left breast. Following a circular pattern, cover your whole right breast. Begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. After the right breast, repeat for your left breast. Move your fingers up and down your right breast, meaning vertically in rows, as if you were mowing the lawn. After the right breast, repeat for your left breast. Step 4. Finally, feel your breasts while lying down, using your right hand to feel your left breast and then your left hand to feel your right breast. Just like while standing, feel for lumps, swelling or thick and enlarged lymph nodes. First, examine your right breast and after that,
of breast cancer is hereditary. That's a very important question you asked, because in my OPD I see that is one of the reasons why women come to us late. They find a lump in their breast and they tell themselves, "Idu breast cancer agat sadhya illa, ikane no family history." But 5 to 10% do have a family history, especially when it happens in a younger women, and in those cases we do certain tests, which is a simple blood test. We can know whether there is an inherited abnormal gene which is running in their family. And it's important to know that because there are a lot of preventive actions that we can take if there is a woman who has inherited this gene. That is, mind you, it's just 5 to 10% of breast cancer that we see. Examination, which we have been talking about, should be started at the age of 20. It needs to be done once in a month, and all that it takes is less than 5 minutes. That's all the time that a woman has to spare. And why is breast self-examination important? Because by doing it every month, the woman gets familiar with her breast. She knows what is normal for her, and then in the future, if some abnormality develops, she can easily detect, and that is when she needs to go to the doctor and seek medical help. So having said that, so monthly once breast self-examination for all women 20 years and above. And mammogram is another very important investigation as far as breast related problems are concerned. A little about mammogram. Mammogram is a kind of X-ray we do of the breast through which we can detect abnormalities very, very small even before they are felt. Now for us to feel a lump when we examine a woman or when a woman does a self-examination, For her to feel a lump, the lump has to be big enough, right? So mammogram can pick up even before it becomes big enough to be felt. We have a very robust health check in Apollo, and apparently normal woman who has no complaints or any problems regarding her breast, mammogram has been done regularly, and we have picked up breast cancer and done a surgery and removed breast cancer as small as 3 millimeters and 4 millimeters. And you can imagine we are talking about early detection. If we detected that early, the treatment, the cure is possible. Treatment becomes simpler and also cheaper. So we would recommend mammogram test for all women 40 years and above. Once in a year is what we would recommend, and breast self-examination once in a month for all women 20 years and above. However, if somebody has an abnormal gene, there's a strong family history, there's a different kind of surveillance we do. We start them much early at the age of 30, and we also add breast MRI to them.
Doctor, are food habits somewhere related to cancer?
Well, yes, food habits are certainly related, but I wouldn't say that there is one particular food that can either prevent or cause cancer. So like we said, flavonoids are present also in lot of fruits, in vegetables, also in dark chocolate. So eating as natural food as possible is important. Adding lots of fruits, vegetables are important. They build up immunity, they have antioxidants which take care of the free radicals which can lead a normal cell to become cancerous. Regular exercise is important, as I would always say, and that is one of the leading factors in umpteen number of studies which have shown that women who are physically active have a reduced risk of breast cancer.